My name is Rashay Price. I'm your student nurse for today. The purpose of our home visit is because your child, baby Joshua, was diagnosed with bronchiolitis. And as you may know, bronchiolitis is a viral infection that causes inflammation in the small airways in his lungs. Yes, in his lungs.
It's most common in children under 2 years old and often starts as a cold and then gets worse. Some children with bronchiolitis are hospitalized because they need oxygen to help them breathe, or because they are dehydrated and need more fluids.
As we discussed, there's no cure for chronic bronchiolitis. However, there are medications and treatments that you can do to relieve the symptoms. For example, you can start ensuring that baby Joshua has enough water.
Treatment includes measures to ensure that the child consumes enough fluids and is able to breathe without significant difficulty. Most children begin to improve a few days after first developing breathing difficulties, but wheezing can last for a week or longer. Bronchiolitis can cause serious illness in some children. Infants who are very young, born early, have lung disease or heart disease, or have difficulty fighting infections or handling oral secretions are more likely to have severe disease with bronchiolitis. It is important to be aware of the signs and symptoms that require evaluation and treatment. Also, try keeping your child's head raised to make it easier to breathe. Don't use pillows for infants. Use a rubber suction bulb to remove mucus from your child's nose, and ask your healthcare provider to show you how to suction your nose if you don't know how to. Clean your hands before and after touching your child. Your child, if old enough, should also be using a hand cleaner. Do not smoke or let anyone else smoke around your child in your home. And keep in mind that wheezing and coughing from bronchiolitis can last for weeks after your child is sent home from the hospital. Listen to your child's breathing for signs that it's getting better or worse. Finally, give all medicines to your child exactly as directed.
So I know we just discussed several treatment methods that you can use for baby Joshua to relieve his symptoms. What are some that you think would fit in your household that you could use for him?
I'll make sure that I give him a lot of fluid. I'll make sure to use the rubber suction when needed. I'll make sure that when he's sleeping, his head is elevated in the right direction. I'll make sure that my hands are clean. I'll make sure that nobody in the house that smokes should be near him, and I'll make sure to give him his medication when prescribed.
Great, that's good.
Thank you.
Do you have any questions?
No, you have covered everything. If anything comes up, I'll make sure to follow up with you or my pediatrician. Thank you.
Be sure to call 911 right away if your child has any of these following symptoms. If they are less alert or have loss of consciousness, if they are blue, purple, or gray color in their skin, fingertips, or lips, if they have trouble breathing, are unable to talk, or wheezing that doesn't get better with treatment.
Well, thank you for your time. I'll be sure to follow up for our next appointment.
Thank you.
Bye, nurse! Bye! Bye!